Hi, my name is Chacha. I have an early childhood certificate and have practiced preschool teaching for 5 years. So I'm starting this new video series on parenting and childcare. And today's video is on how to respond if a child is throwing a tantrum, even if the tantrum is in a public space and it's embarrassing. And it can be really hard when a child throws a tantrum because that can bring up a lot for anybody who witnesses the tantrum. It can bring up insecurities and it can bring up pain. But the most important thing to realize is that this child is expressing a need. And the most important thing to do is to show this child that their feelings are valid. So this can look different for every child. I really like being held when I'm having a hard time, and it's possible that the child that you're working with might also want to be held or hugged. It can help kind of calm the heartbeat if two hearts are next to each other, and so if your heart is calm, if you're able to maintain calmness, then holding the child close to your heart can help calm them down as well. If you're not calm, then there are other ways as well to validate the feelings, and we'll get into more self-care stuff later in this video. So other things that you can do if to show a child that their feelings are valid is giving them space. And this tells them that they're respected and that they can address their need when they are ready. There's also, especially for younger children, if you look at them in their eyes and they see you, then you can match your face to theirs. So if they're really sad, you can cry. And then once they see that, then you can slowly start to move it up into a neutral or even positive facial expression. And the first validates them, and then the next shows them how to calm themselves. So that can be really helpful. Different children respond differently to different techniques. So getting to know the child you're working with is actually the most important way to know how to communicate to them that their feelings are valid. It might be that you find yourself getting really frustrated or even angry. If this is the case, please practice self-care. Address your own emotions before trying to help a child address theirs, because otherwise there'll just be escalation. And what is really beneficial for everyone is if the situation de-escalates and everyone can come to a calm point. So practice self-awareness so that you can catch yourself before your emotions are so strong that they're impacting your child or the child that you're working with. And you can practice self-soothing techniques. So for me, I take deep breaths. I go for walks, I eat, I sing, I take a break from the child, I walk away. These are strategies that work well for me, and they might work for you, they might not, but the most important thing is that you find what works for you, and then once you're calm, try again to communicate with your child, or the child. Do what you can to meet your child's needs. So this means that you need to have effective communication with your child, so you might need to get to know them better. It might take a while before you're able to meet their need. Most children express different needs differently. So maybe hunger is expressed as a complete tantrum throwing things, big fet, but maybe if they're more fussy and whiny, then that's just because they're sleepy. So those are two different needs, right? There's hunger and there's sleep. And really get to know the child you're working with so that you can know how to meet their needs. And finally, if you find yourself yelling at a child or hitting, spanking, pinching, or otherwise hurting them, please seek out a support group and or therapy. This can provide you with an opportunity to understand your own feelings and your own behavior, and also with an opportunity to learn more about respectful parenting. So try to validate the child's feelings, practice self-care and self-awareness, and do what you can to meet your child's needs. And if this is really difficult, if the child is really hard to communicate with for you, seek out a support group. Thanks.